Good morning. I am Ms.Dipti Yadav, nursing tutor from Rama College of Nursing. We'll discuss the topic diarrhea in children. So how do we define diarrhea? We define diarrhea as passage of loose watery stools more than 3 times in a day. As we know, diarrhea is one of the leading cause of infant mortality rate across the world. So the causative organisms, mainly it is caused due to infection, a viral infection, a bacterial infection, or an infection by a pathogen. Some of the common organisms are your Shigella, your rotaviral infections, cholera. These are some of the common organisms which causes diarrhea in children. The next is your malnutrition. Poor nutrition in children, lack of exclusive breastfeeding and lack of breastfeeding can lead to malnutrition and thus cause diarrhea in children. Next is poor sanitation. Poor sanitation includes your improper food handling, improper hand hygiene, lack of sanitation, lack of proper drinking water, and unhygienic food conditions. These are some of the causes which can cause diarrhea in children. So next, after causes, we are your classification. So how do we classify diarrhea, or we can say types of diarrhea? So we can classify diarrhea as acute and chronic. So we say acute diarrhea when your diarrhea is for 14 days or 2 weeks, and we call it as chronic when the diarrhea continues for more than 14 days. And we also call your chronic diarrhea as your persistent diarrhea. Clinically, we can define diarrhea as acute watery diarrhea and acute bloody diarrhea. When there is passage of loose stool, then we call it as acute watery diarrhea, and when with the passage of loose stool there is presence of blood, mucus, which is due to your disruption in your mucal membrane of intestine, we call it as acute bloody diarrhea, or we also call it as dysentery. So this is the classification of diarrhea. After classification, we will look after your sign and symptoms. Sign and symptoms. So the significant sign of diarrhea is your dehydration. Dehydration is one of the significant clinical feature of diarrhea. Then there will be some other features: fever, pain in abdomen with cramps, nausea and vomiting. With this there will be anorexia, and because of anorexia there will be severe weight loss. So how do we see dehydration? We can classify dehydration as no dehydration, some dehydration, and severe dehydration. Or we can also call it as mild dehydration, moderate dehydration, and severe dehydration. Mild and moderate dehydration can be cured at home or with some interventions, basic interventions like your fluid therapy and your ORS therapy. But your severe dehydrations needs hospitalization with immediate fluid administration. So how do we say it's a mild dehydration or it's a no dehydration? When there is less than 3% of body weight loss. When there is less than 3% of body weight loss, it is called as no dehydration or mild dehydration. When the weight loss is from 3% to 9%, it is moderate or some dehydration, and when there is more than 9% of weight loss, it is called as severe dehydration. So after diagnosing, after looking after the clinical features, we go for the diagnosis. How do we diagnose the case of dehydration? So as we know, the basic thing or the initial step in your diagnosis is your history collection. So your first point is your history collection. In history collection, we'll ask the parents, we'll ask the children if he can say, if he is a toddler or an infant who can tell us something about his disease condition, or the parents will ask them about the number of stools the child is passing. What kind of stool it is? Is it watery? Is there passage of blood with the stool? Any other thing? Then in any past duration, whether there was fever with the child, whether child has taken any medicine, any home remedy, we have to collect all those histories. Then comes your physical examination. In physical examination, the first thing that we will assess for is your dehydration. What is the level of dehydration? You can assess the level of dehydration by checking the skin turgidity, by looking for your sunken eyelids, by looking for any abdominal distension. Then after physical examination, we can go for your stool culture and sensitivity. Stool culture and sensitivity is required to check for presence of any organisms, to check for the ovas of the organism, to check for the mucus, to check for the blood cells. The next is your blood investigations or lab investigations. In lab investigation, we will go for CBC and we will go for mainly your electrolytes level and your BUN level. Why we go for your CBC? CBC because as we know there is passage of blood, so there can be decrease in hemoglobin level, to look for that. Then there are electrolyte imbalances. To check for that, we look for your sodium potassium levels and your creatinine level, your nitrogen levels. So BUN for that. The next comes your management. So first and the primary management which we can give at home is your ORS, oral rehydration salt. It is easily available, it is cheaply available, and we can also prepare ORS at home. How do we prepare ORS at home? We boil 1 liter of water, we add 4 tablespoons of sugar and half tablespoon of salt, and it needs to be consumed in a day. A minimum 1 liter of water to be consumed in case of your dehydration or in case of diarrhea to correct your dehydration. And in a packet of ORS, the substances, the composition of ORS, there are 4 major things, there are 4 components of ORS. So first one is your sodium chloride, potassium chloride, glucose anhydrase and sodium citrate. So these are the 4 components which are present in your ORS. After ORS, what we can give to a child is your fluid therapy. Fluid therapy is must in case of your severe dehydration. In case of mild and moderate dehydration, you can take oral fluids, you can give oral fluids to the child with your juices, your coconut water, all these fluids can be given. And in case of your severe dehydration, IV fluids can be given, your NS, normal saline, RL, Ringer lactate. All these fluids can be administered. After fluid therapy, the management includes your immunization. Immunization, your vaccination is must to prevent your diarrhea. A child should undergo a complete immunization to prevent any diseases, and mainly your rotavirus vaccine which prevents the children from diarrhea. So immunization is important. Next is your breastfeeding. We should advise mother to provide exclusive breastfeeding for 6 months and complementary breastfeeding up to 2 years. So breastfeeding is important for child's maturation, for child's growth and preventing the child from diarrhea. After management comes the complication. As we know, there is passage of fluid, there is loss of electrolytes. So the first major complication of diarrhea is your electrolyte imbalance. So your electrolyte imbalance consists of your hypokalemia, hypernatremia and hyponatremia. Apart from your electrolyte imbalance, there can be acute renal failure. Acute renal failure because of your severe dehydration and shock, it can lead to your acute renal failure. Hypoglycemia. Hypoglycemia because there is with the dehydration, with the diarrhea, there is loss of bicarbonates in your stools, so which leads to your hypoglycemia. So these are some of the common complications and some of the major complications that we can see in case of your diarrhea. The last and the most important thing, as we know, diarrhea is one of the common disease which is very prevalent in children, in infants, but it is highly preventable. We can prevent diarrhea. So our prime focus or the major public health interventions which focus on preventing diarrhea is by following these preventions. So how do we prevent diarrhea? So first and the important thing is your exclusive breastfeeding. Exclusive breastfeeding prevents the cases of your diarrhea. Exclusive breastfeeding. After exclusive breastfeeding is your immunization. Complete immunization. In your immunization schedule, we also have vitamin A supplementation. So vitamin A supplementation is important with diarrhea. In diarrhea, your zinc supplementation is also important. So providing zinc supplementation. Boiling of water. If there is unhygienic conditions or there is unsafe drinking water, then the drinking water should be boiled before consuming. It prevents the risk of having diarrhea. Hand washing, hand hygiene. The mother should wash their hands properly before preparing the meal, or if child is taking meal on his own, he should wash his hands before having the meal. So hand washing and proper sanitation, cleanliness around in the surrounding, in the home, nearby and in the areas where the food are being prepared. Hand hygiene and sanitation should be maintained. So these are some of the basic things which will help in preventing diarrheas. So this is all about diarrhea from my side. Thank you.